So the final presentation for today, Ellen Demlow and Glenn Doupe from Vancouver Coastal Health. So Ellen is a regional epidemiologist for Vancouver Coastal Health Authority, primarily working on the monitoring and evaluation of the Seek and Treat for Optimal Prevention of HIV/AIDS program. She's passionate about tackling health inequities using data-driven decision-making. Glenn has worked in the field of gay men's health for over 10 years. Currently, he works with the VCH STOP team as one of the nurse educators. And previous to this, he was a team leader for the BCCDC outreach program. Glenn is a prairie boy who has lived in Vancouver for the past 30 years. He loves Vancouver and the community he has found here, but also enjoys traveling. Glenn has attended the Gay Men's Health Summit every year since its inception. And from their title, I'm guessing that they're going to be sharing with us some good news. Vancouver Bathhouse clinics meet important healthcare needs for a marginalized population at high risk for HIV infection.
So good morning, everyone. It's great to be here. I'm Glenn, and this is Ellen, in case there was confusion. So we're just going to dim the lights, and Ellen is going to pass out some towels. And just kidding. So we're here to present the Vancouver Bathhouse Survey, which is the VCH initiative. And so it's entitled, our presentation is titled, Vancouver Bathhouse Clinics Meet Important Healthcare Needs for a Marginalized Population at Higher Risk for HIV Infection. So I'm going to give a little bit of background, just for people who are unfamiliar. So the epidemiology in VCH, from January 1st, 2011 to June 30th, 2014, there were 546 newly diagnosed HIV positives. Overwhelmingly, those were male, 91%, and 73% were MSM, or 80% of the males. Fairly evenly distributed across age categories. But at the bottom, we've been doing point of care in the bathhouses for quite some time. And from May 2013 to March 2015, we had a yield of 0.8%, which is actually 8 times the cost-effectiveness ratio for routine HIV testing. So right away, we know that what we're doing there is worthy. But I just wanted to give a background, a little bit of history of bathhouses in Vancouver. We've been there a long time in terms of public health or community health nurses. I was talking to Patrick Loftus yesterday, and he started his man-to-man project in 1988. So 1988 is when public health was in the bathhouses. So we've engaged in various ways throughout those years, some testing events and blitzes, a lot of hepatitis immunizations in the late 1990s, and even a mass syphilis campaign in the early 2000s. So it's really set the stage for what we have today. And this is Paul Harris. Many of you will know. He works at BCCDC at Butte Clinic, and he manned the bathhouse. He was the bathhouse nurse for years, all through the late 90s and early 2000s. But this is what we used to do. We just used to get a room and hang up a paper sign that said nurse, and we were announced, and people would come and see us. But this has changed, and it's changed because of the advent of STOP, I think. So STOP, Seek and Treat for Optimal Prevention, in 2010, there was an influx of money. So we established permanent clinic sites in all of the bathhouses around town, and this is what they kind of look like. It's hard to get a good picture because it is still the same space, so it's very small. So Stephen Lofton, one of our nurses, actually has been fantastic in outfitting these rooms. So we have permanent spaces at Steamworks, F212, and the Red Door. And who we are, we're sort of like the testing component, male nurses that work with the STOP team. And we staff, we are about 36 hours or an equivalent of a full-time nurse position divided between those bathhouses. It has really high acceptance from bathhouse management and clients there, and also from our management. And we've tried various times across the last couple of years anyway to be there to sort of catch different clientele that are coming to the baths. We've done some night shifts on Friday and Saturday night, some Sunday day shifts, pretty much every day of the week, daytime and evenings. How our clinics work is that the bathhouses have a schedule of when we're going to be there. We work monthly. We give them a monthly schedule. When we get there, the front desk staff just tells the clients that are coming in that we're there. And there's posters around the club like this. We put up extra posters saying that we are there, and clients self-select to come and see us. It's a totally passive event for us. We sit in that room until somebody comes to the door. And so what services we offer, it's pretty full scope. It's like going to an STI clinic now. It's not just STI testing, but we do a lot of education there. A lot of people come just to talk about, is this true, is that true, to get that kind of healthcare information. We make a lot of referrals, and the two previous presentations, the health promotion case managers we work with really closely, but also the nurse practitioner. We work with the peer navigators quite a lot when we diagnose somebody who is newly HIV positive. We do a lot of follow-up. Health education is a big thing there, psychological support. Some vaccination is difficult because we don't have refrigeration there, but we can vaccinate. So we did just a clinic intake survey kind of at the same time as we did our bathhouse survey, just to see how many people were coming to see us. So from June 2nd to October 26th, we had 529 visits. The median length of time was 20 minutes. Most of those were at Steamworks because we're there more often and it's the bigger bang for our buck. Fewer at F212 because we're there less. And the Red Door is morphed into something different for us. We do a lot more case management there, a lot more referral to other services and working with like the case managers there. So services provided, a lot of health education, testing, both HIV and STI, psychological support, general information, and referrals. So education is a big thing there. A lot of the education we give is transmission information, signs and symptoms, risk reduction counseling. Lots of questions. Vaccination was a big thing, I think, over this last summer because of the Get Guarded campaign, but also we had a lot of free Gardasil vaccination we were giving out. I'm surprised here that PrEP and PEP was so low, and also viral load suppression, because it seems like we're talking about those things all the time. So our study question really is, do area bathhouse clinics address gaps in healthcare for a population at higher risk for HIV infection? We had, there's never really been done a survey, or it's all been anecdotal evidence that we've sort of gleamed onto as to what's sort of happening out there at the bathhouses. So that anecdotal evidence we've made into supporting hypothesis, and this is how we are going to prove or disprove our study question. So these are comparative surveys, and we're comparing to a local health, it's a HIM clinic. So we're saying bathhouse clinics serve a more ethnically diverse population. More men who visit the clinic at the bathhouse are recent arrivals to the Lower Mainland, either through immigration or migration. Men who visit the clinics at the bathhouse are less likely to identify as exclusively gay, and men who visit the clinic at the bathhouse are less connected to mainstream gay community. So I'm going to let Alan do the results and the methods.
Great, thanks, Glenn. Do I just hit down? Or?
Yeah.
Okay, so there are methods. So in order to test those hypotheses, we developed a digital survey that we offered on iPads at all of the clinics for pretty much any patient who wished to take the survey. It was completely voluntary. I'm assuming there was no coercion. It seemed like it was a really positive offer of a patient survey. In about a 5-month time frame, 205 of our patients have completed the survey. We are aiming for about 300, so this is preliminary results from our survey. We offered the survey, like I said, on digital tablets, and it was online, although we didn't provide URL. And we only offered the survey in English, so you can imagine that this is a pretty key limitation to our survey, especially because we do think that we are serving a more ethnically diverse population. Anecdotally, from some of our nurses at the Baths, this hasn't been too much of an issue. Obviously, somebody would have to speak up to identify it as an issue, and so we understand that this is a severe limitation to our survey at the moment. But they were able to help if there was sort of some translation or clarification. So our survey content, we offered 24 questions. Our goal was to keep it relatively short. I think keep it within 5 to 10 minutes. Obviously, a lot of the guys that are taking the survey have other things to do during their visit, so we kind of wanted to get them in and out. And we really wanted to take questions that we could compare with other regional surveys. So we took a lot of demographic questions from the Health Initiative for Men intake survey of their clients, and we also took questions from the Sex Now survey. So for the demographics, we did inquire about age, ethnicity, residence within the Lower Mainland as well as abroad, and across Canada. It's not really abroad. Gender identity, sexual identity, as well as education. We also asked about healthcare access and HIV and STI testing frequency, HIV and STI prevention techniques, just community support and openness, services received at the Bathhouse Clinic, a bit of an analysis of how they feel about the clinic, and as well as just their level of satisfaction with the clinic. So our great friends over at Health Initiative for Men did provide us with aggregate client demographic data from both sites, so for him on the drive and him on Davie. During a relatively comparable time period to our survey, it was a few months prior to us launching our survey. And the data that we got from him included age, ethnicity, and sexual identity. And like I said, Glenn had inferred, what we wanted to use the HIM clinic data for was basically to compare the demographics of sort of a generalized men's health clinic in the city to our clinic in the bathhouses, just to see if there's any demographic differences. All of those demographic differences were tested with Fisher's exact test, and the significance was set at an alpha of 0.05. So for people whose statistics are terrifying, I don't blame you. Anytime you see a p-value that's less than 0.05, we consider that a significantly different association or prevalence, proportion. So let's get into the results then. So when we looked at patient demographics, just quickly looking first at age, so we compared this again to the HIM clinic data, and we found that our patient population was significantly more likely to be older than patients who visit the HIM clinic. 41% of our patients are 45 years or greater, compared to 15% of patients at the HIM clinic. When we look at sexual identity, we found that there was no difference in the proportion of patients that identified as gay. However, we did find a statistically significantly higher proportion of bisexual men in the Bathhouse Clinic versus the HIM Clinic. There was a higher proportion of men at the HIM Clinic that identified as straight versus at the Bathhouses, and other sexual identities were identified at much lower proportions. And when we look at ethnicity, it's important to note that men who visited the clinic at the Bathhouse were significantly less likely to identify as Caucasian. So we had a higher proportion of a visible minority population. We were significantly more likely to see Southeast Asian men compared to the HIM clinic, significantly less likely to see South Asian, and more likely to see African or Black ethnicities, although those numbers were still quite small. When we looked at patient residence, the length of time living in the BC Lower Mainland, so we were quite surprised by this, at least still preliminary result. We had a bit of a perception that that actually a lot of the men that were coming to the Baths were potentially recent arrivals to the area, and we found that 55% have been in the Lower Mainland at least for greater than 5 years. So this was a bit of a surprising result. Top municipalities of residence, no surprise that Vancouver is the predominant resident, but we did have about 6% coming in from Burnaby, from Surrey, Richmond, a lot more places at much lower percents. And we also had quite an interesting makeup of clients that were coming from across Canada, and as well as across The U.S., we had some men that were Filipino, from the Philippines, as well as some men coming from South Africa. So great, you can meet everybody from around the world at these clinics, which is kind of fun. When we asked about patient openness about their sexuality, we basically looked at kind of different social and professional network parts of your life. So we asked about family, friends, and workplace, and we said, does everyone in your family know about your sexuality, or do some, or do none? And what we found is that, and this is a Sex Now question for those people that are very familiar with that survey. So for example, we found that 44% of respondents said that everyone in their family knows about their sexuality. And I just want to say, in light of Ram, in light of your talk yesterday, I am really curious to stratify some of this by ethnicity, because I think what I learned from your talk too is that openness in different settings doesn't necessarily indicate someone's sort of acceptance with themselves, with their sexuality, et cetera. So I thought your talk was fantastic. Thank you. 52% agree or strongly agree that they feel supported by the people in their life concerning their sexuality. 16% identified not feeling supported. When we looked at length of time with other MSM, 25% reported little of their time, 22% reported a quarter, 24% reported half, 16% reported most of their time. So we don't really know what to think of this yet. We are waiting to compare this with the Sex Now data. So at the moment, this is just descriptive. So stay tuned for the final report. But we are pretty excited to compare this then with some of the more regional surveys for gay men's health. When we look at patient healthcare access, we ask patients, where do you routinely access medical care? And 52% did identify a family physician, followed by 35% a walk-in clinic. But when we asked patients where they received HIV and STI testing, about 14% identified their family physician, and much higher, 33% at STI clinics like the Butte Street Clinic or the HIM clinics, 60% at STI outreach like the Bathhouse clinics. I would say not too surprising considering we're asking people at a Bathhouse clinic, but I do want to highlight, though, a little bit about that family-physician relationship. So among the men who identified getting routine care at a family physician, 25% of patients said that they received routine HIV and STI testing there, even though 75% of patients with family physicians say that their physician is aware they are MSM. Now, we can't read too much into this. I think what we can infer is that perhaps currently, at least to address the health needs of this specific population, that we might need a variety of settings. So I don't want to read too much into this until we have more comparative data. But what we do know, though, is about the men who visit our clinic, or at least these are the services that they identified receiving, and about 93% said they received HIV and STI testing. So we do think that we are addressing a highly specific need for this population of focus. 41% said they received support and encouragement. And I think this is just a great aspect of this clinic in general, is that given that the median time of a patient interaction is about 20 minutes. That does provide time to address a wealth of sexual health needs. 40% received HIV and STI symptom information. 32% received risk reduction counseling, and 11% did say that they were referred to other LGBT services in the community. Wrapping up, I know, thanks. Really quick, so just the patient self-assessment of the Bathhouse Clinic. We were thrilled to see that 90% of our patients agreed that they received the services that they needed. 88% of patients agreed that the time they spent with the nurse was suitable. 85% found the clinic space adequate. I'd be curious to ask the nurses if they think the clinic space is adequate. I hear it's quite small, but at least the patients are happy. And 89% think that this Bathhouse Clinic service is valuable.
So I'm just going to give some concluding remarks and just next steps. So these are our conclusions. Vancouver Bathhouse clinics serve a demographically different patient population than an established men's health clinic by age, sexual identity, and ethnicity. A greater proportion of Bathhouse clinic patients live in the Lower Mainland than we expected. Among patients with family physicians, a lower than expected proportion receive HIV, STI testing from their family physician. Bathhouse clinics provide an important healthcare service to patients at high risk for HIV acquisition. So just next steps, we're not finished the survey yet. It's still ongoing, and we probably will go until January. Our questions around community connectiveness, risk reduction, behavior, testing frequency all need to be sort of compared to the current Sex Now data. And we plan to use the results of this survey and clinic documentation for quality improvement. Just some acknowledgements, and then we're done. Health Initiative for Men, both the managers at Davie and Commercial Site, Hans and Sam, for giving us their survey, their intake survey, community-based research, Olivia Ferlat for sharing the questions for the Sex Now survey, Steamworks, F212 and the Red Door for their ongoing support, and special thanks to Patrick Wansborough and Steve Lofton, who do the lion's share of the Bathhouse Clinic nursing. Thanks.